In Nigeria, the birth of a child is a season of intense celebration. The house fills with family prayers and laughter, but behind closed doors, the reality can feel entirely different. Instead of joy, you might feel empty, numb, or so completely overwhelmed you cannot imagine making it through the next hour. The pressures from mothers-in-law, husband, and the wider community often demands a performance. A new mother is expected to be strong and entirely grateful. To admit anything else is frequently seen as a failure. So women suffer in silence. They hide the numbness and the fear out of a specific terror of being judged, turning a frightening internal struggle into an isolating secret. These visuals represent exactly how common that hidden emptiness actually is. 1 in 5 new mothers experiences it. You are far from the only one feeling this way. Yet, in many parts of our culture, the struggle is brushed off as a lack of resilience or mislabeled as a spiritual attack. The stigma attached to mental health issues build a wall, knowing the judgment that waits outside. Mothers stay trapped inside their own minds. The immediate threat to a new mother's safety in this moment is the silence demanded by societal expectations. This timeline graph shows what happened inside the body. After childbirth, there is a dramatic plunge in hormonal levels. Over the first 2 weeks, this chemical drives what we call the baby blues. This drop causes tears for no clear reason, mood swings, and feeling overwhelmed. Up to 80% of women experience this. And as the graph shows, those hormone levels naturally stabilize by the end of week 2. But look at the divergence line. This represents postpartum depression. It can start at any point in the first year, and the depression indicators remain high well past that 14-day mark. It does not go away on its own. It gets worse without intervention because it is a persistent medical condition. It is a biologically illness, not a temporary mood you can simply shake away. The timeline is a diagnostic tool. If the darkness outlaws that 2-week window, you're dealing with an illness that requires medical attention. The symptom attack both the body and the mind. You may find yourself unable to sleep even when the baby sleeps. Your appetite might vanish and you might eat too much, and simple decisions become difficult. Emotionally, there's often a disconnect that can mean you feel disinterest toward the child, or the exact opposite, a paralyzing extreme anxiety about the baby's safety at all times. This reaction breeds an intense sense of guilt. The illness tricks the brain into believing a false conclusion that you're a bad mother. The most severe symptoms involves intrusive thoughts of harming yourself or your baby. If this thought occurs, they may be shared with a doctor or a trusted person. Immediately, you need and deserve emergency support. Every single one of these terrifying thoughts and feelings are standard markers of a disease. They are disconnected from your true nature or your capacity to love your child. Recovery begins with a single action: speaking out, telling a doctor, or gripping the hand of a trusted friend and admitting to you are unwell. Removes the power of cultural silence. Once spoken, medical treatment becomes available. Speaking to a counselor provides specialized talking therapy. And doctors can prescribe safe antidepressant medication that will not interfere with breastfeeding. There is an immediate relief when a professional identifies these symptoms as part of a treatable condition. Shifting the focus from your character to your health. Treating postpartum depression with the same medical seriousness as malaria provides a structured pathway towards recovery that clinical data shows is highly effective. Medical treatment is more effective when paired with concrete support at home. Practical help with feeding, cleaning, and holding the baby gives the mother's brain and body the actual hours required to rest and recover. Husbands and mother-in-law play a critical role here. They must look for the sign and ask gently and directly, "Are you okay? Do you need help?" The stakes are for the entire family are high. A baby needs an emotionally present mother to try, and a mother needs unwavering support to be present. Overcoming this illness is not a solo test of willpower. It is a community effort built on a foundation of medical truth, honest communication, and compassionate support.